Hi everyone, welcome to Anato-Bee tutoring session 7. Dr. Frank, is this session 7? Okay, thank you
It
everybody
is.
that's nodding. Yes. So we're doing all things GI today. Very exciting. This is one of those tutoring sessions where I feel like everything's really connected and you can really start building off of the content as we move through. So I think we're gonna have a great time this afternoon, this evening, depending on what time zone you're in, and I will pass it over to Dr. Frank to get us started.
Hey, well, good evening, everyone. Hope you had a nice, relaxing, productive Thanksgiving holiday. Um, and we are back at it. We were just here last week. It seems like we never left, but we are back. This week, we're going to be looking at the gastrointestinal, or what we call the digestive system. So, first up is anatomy of the gastrointestinal and digestive system. And we have with us this evening Savannah Gregory. Savannah is from Nashville, Tennessee, and graduated
Doc-
from the
Dr.
uni.
Frank, Dr. Frank, we have AnaBelle Torres instead of Savannah Gregory.
Oh my gosh.
Sorry.
I'm sorry. I'm sorry. 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 Oh my Lord. Okay, just give me a second here. That is weird. It resorted back to my old. There we go. We would have had Savannah, but instead we have AnaBelle Torres. And my apologies, I thought I had picked the right one here. So AnaBelle is from Winter Haven, Florida, and she graduated with her bachelor's degree in biomedical sciences from the University of South Florida in 2023. She's currently a second year medical student at Edward Via College of Osteopathic Medicine in Auburn, Alabama. In her free time, she enjoys reading, hiking, and spending time with her family. So sorry to take you away from your family this evening, but we're glad to have you here. So AnaBelle, the floor is yours.
Hi, my name is AnaBelle, and I'm going to be doing the digestive anatomy. So I'm going to go ahead and share my screen. Can you see it? It doesn't look like it's full screen for
It wasn't full screen, but we could see enough. I think it was okay.
There we go.
Perfect.
that.
Thank
Okay,
you.
cool.
And we can see your cursor. So that's good.
Okay, good. So yeah, like I said, this is digestive anatomy, which is perfect because we just had Thanksgiving. So these are the lecture objectives. So I just wanted to do a quick review of the structures. So in digestive anatomy, everything goes in and must come out. So the mouth, the esophagus, and then the stomach. From the stomach, you go from into the small intestine, which is made up of the duodenum, the jejunum, and the ileum. And then you go into the large intestine or the colon, which has the ascending.
AnaBelle, sorry to interrupt you. Would you mind using your pointer to point out the pathway of everything as you identify it?
Yes, sorry.
No, that's okay.
Okay, so I'll just start over. So we have the mouth, and the tongue. And so when you eat a bite of food and you swallow it, it turns into a bolus. And you swallow it and it goes down the esophagus, into the stomach. And then once it's in the stomach, it leaves the stomach, into the small intestine. And the small intestine, which is all of this, is made up of the duodenum, the jejunum, and the ileum. And then once it's finished in the small intestine, it goes into the large intestine or the colon. And the colon is made up of the ascending colon, the transverse colon, and the descending colon, and the sigmoid colon. And then once you're finished at the sigmoid colon, you go into the rectum and the anal canal to leave the body through the anus. So I just wanted to include that so that you could see the pathway, from start to finish. And then this was a cadaveric image that I found that I thought was helpful to show, the vasculature supplying the digestive tract to put it all together. So I just wanted to start off with a question. So which of the following is considered a part of the foregut? A, gallbladder, B, jejunum, C, rectum, D, ascending colon. Okay, so it looks like 92% of people have answered. Choice A, and yes, choice A is correct. So our digestive system is divided into the foregut, midgut, and hindgut. Um, so this was like what I was talking about, um, the start to the end. And then the brackets on the right are showing what is part of the foregut, the midgut, and the hindgut. So when I was learning this, I like to think of things as a story the best I can when I'm trying to learn something. So the foregut is I think of it as the front or like the forefront of my mind. So the beginning of the digestive tract, the midgut, like the middle, of the digestive tract, and then the hindgut being the end. So this pink bracket is showing everything that makes up the foregut. The blue bracket is showing the midgut, and the green bracket is showing the hindgut. And I also included this list, which at first glance looks really intimidating. It's showing a list of everything that's making up the foregut, the midgut, and the hindgut. But like I was saying earlier, it's not as intimidating as it might seem to begin with, because again, I divide it into the beginning of the digestive tract, the middle, and then the end. And then I also included the blood supply, the things that are supplying blood to the foregut, the midgut, and the hindgut. Um, so question 2, what is the main function of the gallbladder? A, creates and processes bile for digestion. B, produces clear juice to aid in digestion. C, stores, concentrates, and sends bile into the duodenum. Or D, processes and propels chyme through the digestive tract. Oh, sorry, I clicked something and it's not letting me go back. But it looks like everyone knew it.
Yeah, looks we should get 100% on this one.
Yeah.
I'll end that, and by gosh, we did. Okay.
Yeah, so everyone knew that one pretty quick. The gallbladder stores, concentrates, and sends bile into the duodenum. So I included this photo on the bottom, which is kind of looking at the liver from underneath because the gallbladder sits just underneath the liver. Um, so this red is the liver and the green is the gallbladder. And that's just showing the relationship, to help you better picture how everything comes together to work. So question 3, which of the following Sorry, I have a notification blocking everything. Okay, question 3. Which of the following structures is involved in both digestion and respiration? A, the larynx, B, the pharynx, C, the esophagus, D, the stomach. So it looks like everybody answered. Oh,
Can you see the results?
I can. Yes.
Okay.
So
Because
it looks like almost everybody answered. And it was a little bit split. But the answer is B, the pharynx. So I included this photo to help visualize all the things going on up there. So the pharynx is shown in purple here. Um, the larynx is more of like what colloquially is referred to as the voice box. So the larynx is really only involved in respiration and speech, versus the pharynx is kind of like the common hallway. I like to think of it as it's involved in both digestion and respiration.
We've got a question in the chat. Maybe you wouldn't mind backing up a bit and discussing the location of the gallbladder in relation to the lobes of the liver.
Yes, my computer isn't letting me go back. I might have to. Okay. Can you see? Okay. So the gallbladder is more on the right side of the liver. Um, so I have this photo on the right to show a little bit better. So here you have the right lobe, and then here you have the left lobe. So if you were to kind of blow that up and look at it on the left, it's kind of underneath the right lobe, but it kind of blends over a little bit into the left lobe of the liver. I'm sorry, I can't see the chat. Does that answer the question?
What about the caudate and quadrate lobes?
Okay, so the caudate lobe is labeled over here. Um, it would be more, it's unfortunately a little bit cut off, but this would be the caudate lobe. And then the quadrate lobe labeled over here would be almost kind of like behind the gallbladder. But there's a little bit of anatomic variation, so everybody is a little bit different. But in theory, this is the ideal textbook relationship.
Thanks, AnaBelle.
So this is the question we just did. So I'm going to go on to question 4. So question 4, which of the following is a major branch of the celiac trunk? A, superior mesenteric artery, B, inferior mesenteric artery, C, left gastric artery, and D, gastroduodenal artery. Okay, so the correct answer was left gastric artery. So I went ahead and listed here the major branches of the celiac trunk. So left gastric artery, splenic artery, and common hepatic artery are the 3 branches coming off the celiac trunk. Superior mesenteric artery and inferior mesenteric artery and gastroduodenal artery all come off separately. They're not branches of the celiac trunk itself. And then I also included this cadaveric image because I thought it was a good way to visualize. So everything is labeled here, but this, I mean, if you could see it, it's all coming from one. And then everything together is making up the celiac trunk. So you have this one that's forming the common hepatic artery. This would be the left gastric artery. And this is the splenic artery. And then again, they're all coming off of a common celiac trunk. Question 5, the liver, stomach, and duodenum are all supplied by which artery? A, celiac trunk, B, superior mesenteric artery, C, inferior mesenteric artery, and D, gastroduodenal artery. Okay, so it looks like everybody has answered this one. So the answer was the celiac trunk. So those three branches that we were talking about earlier, those all go off to supply all three of these organs. Question 6, where do the hepatic artery and hepatic portal vein enter the liver? A, central vein, B, porta hepatis, C, common hepatic duct, and D, common bile duct. Okay. So the answer to this was porta hepatis. Porta hepatis is just the name of the area where the hepatic artery and the hepatic portal vein enter. So this is a photo of a real liver. And then this dotted line is kind of encircling the porta hepatis. That's just the name of the area where they go in. Um, so this big vessel is the hepatic portal vein. This is just another artery. This is a bile duct. And these are different arteries supplying, but this whole area where all of them are entering in the same place, um, is referred to as the porta hepatis. Okay, question 7. Why is the liver the most common site of metastasis for cancers originating in the alimentary canal? A, it has the most blood vessels. B, cancerous toxins go straight to the liver. C, liver cells are structurally more susceptible to invasion by cancer cells. And D, all blood from the alimentary canal passes through the liver. Okay, so the answer to this one was D. All blood from the alimentary canal passes through the liver. Um, so I couldn't find a super great picture to help visualize this. But this is just the liver is divided into lobules, which I think will be covered later. But basically, it's kind of the functional unit of the liver, and all of your blood from your alimentary canal is going to go to your liver to be filtered at some point. So if you have a cancerous cell or some sort of cancer anywhere in that canal, it's eventually going to go to the liver, which is why a lot of times you see cancers end up metastasizing at the liver. So those were the typical questions, and then we're going to do something new, the Thanksgiving digestion speed test. So this is the first time we've done this, but basically I'm just going to ask a few questions, and then I think you're going to put your answer in the chat, if I understand correctly. And then unfortunately, I'm trying to open the chat. Oh, okay. So I just opened the chat, and so whoever answers the fastest will get a shout out. So question 1, it's all Thanksgiving themed. So you added a big scoop of cranberry sauce to your plate, giving you a lot of extra sugar. Which organ helps manage these sugars by sending digestive juices into the small intestine? Yes, it's the pancreas. So good job. That was really fast. Question 2. You swallowed a huge bite of turkey without chewing enough. Which tube carries that food from your mouth down toward your stomach? Yes, esophagus. Um, I think it's Deepthi. I'm sorry if I'm butchering that. Um, Question 3. Your mashed potatoes were loaded with butter, adding more fats to your meal. Which organ produces bile that helps handle these fats? Yep, it's the liver. So a few people in the chat are writing gallbladder, which is easy to mistake. So the gallbladder is what's holding the bile and then will secrete the bile into your intestines. So when I was learning it, I always thought of the liver is what's making the bile, and then the gallbladder is the waiting area until it's ready to be used. So, but the organ that's making the bile is the liver. Question 4. The day after Thanksgiving, you're getting hungry just thinking about reheating leftovers. Which digestive organ helps signal hunger by releasing a hormone when it's empty? Yep. Um, Elliot was the first, the stomach, but it looks like you all got that one. Question 5. The buttered rolls started breaking down right after you took a bite. Which main organ of the mouth begins both mechanical and chemical digestion? So someone put mouth, which is true, but this is asking for which organ of the mouth starts both mechanical and chemical digestion. The tongue. Yeah, so the salivary glands do contribute, but they're mostly just chemical. But the tongue is involved in chemical and mechanical digestion. Your green beans added lots of fiber to your Thanksgiving plate. Which section of the digestive tract absorbs most of the nutrients from that food? Yep, the small intestine. You guys are really fast. Yeah, the small intestine absorbs a lot of the nutrients, like the grand majority of your nutrients from your food. All that water and liquid from your meal needs to be absorbed. Which organ handles most of the water absorption? Yes, you all knew that one at once. The large intestine. So small intestine is um, nutrients from your food, and large intestine is his big job is water. Question 8. After that enormous Thanksgiving dinner, your digestive system needs to keep things moving along the tract. What is the name for the muscular movement that pushes food forward? Yep, peristalsis. Number 9, you notice you feel a little cold after your Thanksgiving meal, which happens after eating because more of your blood is heading to your digestive organs to help break everything down. Which main artery is dilated to increase circulation to the stomach in this scenario? Yeah, the celiac trunk. And then I think this is the last one. You finished your meal with a piece of pumpkin pie. The leftover indigestible material is now ready to be stored before it finally leaves the body. What is the last section of the digestive tract where this material is held? Yes, the rectum is the last area where it's going to be held before it's able to leave the body. Um, and that's all I had. These are my references. So.
AnaBelle, usually this is where we give the students opportunity to ask questions if there are muddy points that you'd like AnaBelle to go back over, or if you just have general questions for AnaBelle, like maybe how did she get to medical school and what path did she take? And what references would she use and things like that. So if you don't want to open your mic up, you can put it in the chat.
So the question is, what strategies do you use to study these terms? That's a good question. When you're first starting to learn anatomy, it's super overwhelming because there's just so many new words and so many things. So what I did when I was studying this was I like to draw it out, especially things like the digestive tract. I'm a very visual learner. So I have a big whiteboard that's kind of fuzzy in the background. But I like to have like expo markers everywhere and I draw it out and I like to color code it. And that helps me visualize it really well. And then once I've had a good, first pass for myself that I feel like I understand it, I get together with a friend and I talk through it. And that's actually how I even study for most of my classes now. I find that if I can explain it to someone else and have a conversation about it, then I really know it. Yeah. Um, the next question is, do we need to know any other arteries like pancreatic, duodenal, splenic, common hepatic? Um, I'm not sure which specific vessels you need to know.
So just the big ones, in terms of like what would be on your checklist, for when we're like during the exam if we're identifying something, none of those vessels are on your checklist in terms of like needing to identify what they are, but you should, especially that relationship of foregut, midgut, hindgut, and what blood vessels are supplying each is definitely very important and something that if I was to write an exam question on, say, like a local anatomy competition exam, I might be tempted to write a question like that. It looks like AnaBelle, there's another one asking you to describe the porta hepatis.
Yeah, so I'll go back so I can show the photo again. So the porta hepatis is just where the hepatic artery and hepatic portal vein enter the liver. So the porta hepatis itself isn't like its own structure. It's more of an area of where the vessels are entering the liver. So I almost think of it as like a doorway of it's not like you can say like, oh, my porta hepatis hurts or like this is the porta hepatis. It's more of like this is the door to get into the liver. And that's how the hepatic artery and the hepatic portal vein are getting into the liver, if that makes sense.
No more questions for AnaBelle? Okay.
It appears not. Okay. Well, AnaBelle, thank you for uh, taking over for Savannah
Yeah, of
for
course.
this evening, even though I called you Savannah. Um,
That's okay.
so with that, I guess I will let you off the hook and we'll introduce our next presenter, who will be presenting on the histology of the accessory organs of digestion in the GI tract. And Lord help me with this name, but please welcome Deepthi Sathyanarayana.
Yeah.
Okay. I'm not going to say it twice. Deepthi is from Sammamish, Washington, and graduated from the University of Washington with a bachelor's in biology and minor in global health. In her gap years, she spent time as a medical assistant in an abortion clinic and Seattle's Children's Oncology Department. She is currently in her second year at Pacific Northwest University College of Osteopathic Medicine. Her primary interest is in pediatrics and obstetrics gynecology. She enjoys singing, baking, and painting. So with that, Deepthi, it is all yours.
Right. I'm gonna start sharing my screen. Okay. Can you all see? Okay, wonderful. So these are the lecture objectives. We're just going to go through the 4 histological layers of the gut tube, and identify components of the ENS, and figure out where the submucosal and myenteric nerve plexuses are located, and go through the GI tract and explain the histological variations and the structures of the stomach, including its cell types. So, I don't know why the picture is not showing up. Okay. Can someone tell me what this is? Put it in the chat, or let me see if I can open the chat. Anyone have any idea what the structure might be? Yep. So that is the submucosa. Nice job. And then let's move on to this. I kind of give you a hint here. It has these 3 layers. So what could that be? Yes, mucosa. And then we're moving on to here, the circular muscle, longitudinal muscle. Anyone? That's going to be the muscularis. Oop. And then this last one. That's going to be the serosa. All right, so the layers of the gut tube. The mucosa is mostly for barrier protection because it's the one, closest to the lumen. So barrier protection, secretion, absorption. It has the epithelium, lamina muscularis mucosa, as you can see. The submucosa is mostly structural support. So blood supply, some lymph, also glandular secretion. Muscularis externa, it's mostly for peristalsis and segmentation, and it has the inner circular and outer longitudinal. And then serosa is for lubrication and attachment. So we can't really tell the difference between serosa and adventitia histologically. You just have to know that the serosa is for the intraperitoneal organs and it's lined by the mesothelium as well as connective tissue, whereas the adventitia is for retroperitoneal and it just anchors the organ. Yeah. Okay. Kind of the same thing as last time, but this time it's just the histo. It's the epithelium varies mostly by the region. It depends on where you are in the gut tube, and the lamina propria is mostly just loose CT. Muscularis mucosa is a thin, smooth layer. Submucosa is dense, irregular connective tissue, and the muscularis externa has the myenteric nerve plexus, and yeah, that's about it for this slide. I think there's a question coming up. Okay, so a biopsy from the jejunum shows atrophy of the villi, and atrophy just means necrosis or something's dying or not working properly, while the muscularis externa is preserved. Which of the following functions would be the most directly impaired by the damage seen? Um, okay. Okay. So the correct answer is C, the absorption of nutrients across the mucosal surface. The villi is a part of the mucosa, and villi is like required for nutrient absorption. So celiac disease would be atrophy of the villi, and that's why, you don't absorb as many nutrients in that disease. Okay. All right. So question 2. A patient presents with chronic constipation and dilated sigmoid colon. The biopsy shows the absence of ganglion cells in a segment of bowel. Which layer of the GI tract in the affected region is functionally responsible for the patient's impaired bowel movements? All right, can we? Okay. So this is Hirschsprung disease. Okay, 1 second. Okay. So it's a part of the muscularis externa. The Hirschsprung disease, it involves the loss of the myenteric or Auerbach plexus, which I'm going to talk about soon, and it regulates peristalsis in the muscularis externa, and it's a functional obstruction. And when you see dilated sigmoid colon, it's talking about a megacolon, and that's basically like the keyword for Hirschsprung, which is a defect in the muscularis externa. Okay. So the enteric nervous system is kind of like the brain of the gut. You have two plexi, the submucosal Meissner plexus, which is in the submucosa because it says in the name. And it's basically for glandular secretion. It influences absorption, controls the blood flow, whereas the myenteric Auerbach plexus is between the circular and longitudinal layers of the muscularis externa. And this one controls motility, peristalsis, and segmentation. And it sets the baseline muscle tone. So peristalsis is the chyme going out of the stomach into the small intestine, and segmentation is within the small intestine, and the food is just going back and forth, or the chyme is going back and forth. Yeah. And obviously, it's modulated by the parasympathetic and sympathetic input. Parasympathetic increases the activity, so you would know that sympathetic decreases it. And like we talked about earlier, Hirschsprung disease is a failure of the neural crest migration, which I think we'll talk about later. And achalasia is another one where the myenteric plexus degenerates. And there's just a lot of food right at the lower esophageal sphincter, and it can't get into the stomach. Okay, so question 3. So the tissue sample shows non-keratinized stratified squamous epithelium with scattered mucus glands in the submucosa. The muscularis externa contains both skeletal and muscle tissue. So which region of the GI tract is this most likely from? Okay. So we know that the mixture of skeletal and smooth muscle means that we're in the esophagus, and it would be the middle third of the esophagus, because you still have, well, you have both skeletal and smooth muscle. If it's just the lower esophagus, you would only have smooth muscle, and upper esophagus, you would have voluntary control, so that's mostly skeletal muscle. So that's how you know it's the middle esophagus. Um, yeah, the lower you go down, the smoother it gets, I guess. That's one way to remember it. Yeah. Okay, so the histolayers of esophagus, its main function is to protect from the abrasion. So the epithelium is stratified squamous non-keratinized, and that's how you know that we're in the esophagus for the last question, because it's stratified squamous epithelium. Skeletal is the upper third, mixed is middle third, smooth is lower third. You guys got that. And there's submucosal glands for lubrication. One clinical correlate is Barrett's esophagus. It's just metaplasia of the columnar epithelium due to GERD, and the risk factors of that are old men that smoke. Yeah. Okay, this is a question. Which stomach cell normally helps with vitamin B12 absorption and creates stomach acid? Okay. So this one is the parietal cell. It's a pink round cell that secretes acid and intrinsic factor. And intrinsic factor is required for vitamin B12 absorption. If there's a lack of parietal cells, you'll get macrocytic anemia. Chief cells are basophilic. They produce pepsinogen, and renin and gastric lipase and ghrelin, which is used for basically to show that you're hungry. Mucous neck cells produce mucus, and then this is an enteroendocrine cell, and they're secreted basally. And that's about it for this question. Okay. There's a lot of pictures, but hopefully it'll make sense soon. This is the cardiac gland, and it's primarily mucus secreting, and it protects the esophagus from the acid. And so you should just see lots of like secretory acini. This is the fundic or oxyntic gland, and there's supposed to be different types of cells within this. We have the parietal cell here, which is apical and again secretes hydrochloric acid and intrinsic factor. People called this a fried egg looking cell. I don't really see that, but you know, to each their own. And then chief cells secrete pepsinogen, and they're more towards the basal side. And they have lots of rough ER, which contributes to the blue-purple staining. And then the G cells, which are not in any of this, or I can't find it, are supposed to be gastrin, and D cells are somatostatin. So gastrin would be produced after you eat something, and somatostatin would be produced when you're really not eating anything because you don't want to just have extra acid within the stomach. Um, these are called pyloric glands. They're deeper pits and they're more coiled. There's a lot more gastrin or G cells secreting gastrin and the mucus cells that secrete or cells that secrete mucus and protect against the acid. Okay. So this biopsy shows a simple columnar epithelium with many goblet cells, short villi, and lymphoid aggregates in the mucosa and submucosa. Which of the following is the primary function of this region?
Looks like you accidentally moved to the answer
Oh,
on this slide, Deepthi.
my bad. Okay, so well, we have 70 people or 7 out of 10 participation, so I'm gonna move on. So that was a Pyre's patch. I'm gonna move back to this slide. Uh-oh. Okay. This is a Pyre's patch and it's the hallmark of the ileum. Its primary function is immune monitoring, so it secretes M cells and IgA, and you would know that it's the ileum also with the short villi, and the lymph aggregates just talks about the Pyre's patch. But yep, so we have the duodenum here, jejunum here, and ileum. Um, with the small intestine, the main function is to absorb, and you will have villi, crypts, and within the submucosa, you'll have Brunner's glands, which is only found in the duodenum, and then Peyer's patches, which is only found in the ileum. And the Brunner's glands, it's important to know that it's alkaline mucus. In the jejunum, you have the tallest villi and the most absorption. You don't have many glands here. And ileum, we talked about it. Peyer's patches, lots of goblet cells for mucus production again. All right, question 6. A pathologist reviews 4 GI tissue samples. One sample shows simple columnar epithelium, deep crypts with abundant goblet cells and absence of villi. Which function best corresponds to the region from which the sample was taken? Right. So the right answer is D, reabsorbing water and electrolytes. So this the absence of villi should have pointed you towards the large intestine, also abundant goblet cells, also points you towards large intestine. But yeah, when you have no villi, deep crypts, and many goblet cells, those are all uh, indications that you're in the large intestine. And you are right. Reabsorbing water and electrolytes is a function of that. You have, oh, okay, Tinea coli, which are longitudinal muscle bands in the large intestine and abundant goblet cells for lubrication. So that's about it for the large intestine. For the appendix, it's a simple columnar, and the appendix also has lymph follicles, which is similar to a Paris patch. And that's honestly about it for that. And these are my references. Do we have any questions? Oh, can you point to? Okay. Can I point to a goblet cell? Okay. I would have to like zoom in here, but yeah, I'm so sorry. I can't right now.
Yeah, so usually cells that secrete mucus, like goblet cells, or we could just call them mucus cells, like the surface mucus cells or mucus neck cells, they usually have a really pale, almost white staining cytoplasm because the mucus doesn't pick up either the hematoxylin, which would make it purple, or eosin stain, which would make it pink. So it ends up looking like this kind of clear, big space inside the cell. Yeah, I think you have some other examples too in I think the pyloric gland slide. It's a little bit more zoomed in. Yeah.
Ah, okay.
Hmm.
So maybe something like
Yeah.
that. Yeah.
Yeah. So all of the like this would be one single mucus cell. And you can tell again just by these clear, all the clear staining cytoplasm. The nuclei are down here. But that really clear staining up top is because they're just full of mucus.
Thank you, Dr. Mapes.
Any other questions for Deepthi? She really challenged you all today. You did a fantastic job.
I'm gonna stop sharing.
I think we may all be suffering from a little bit of turkey coma.
Yeah, I always feel like in these tutoring sessions, the material just gets progressively hard from anatomy to histology to embryology. So yeah, hang in there.
So one of the questions is how do we work on memorizing the cells in the stomach? I just use flashcards. I really don't have a better answer to that. Yeah, do your Anki every day if you like Anki, but also sometimes mnemonics also really help. I liked what AnaBelle said, like thinking about it like a story. So, um, knowing what happens in every single part, would be beneficial in understanding the GI system as a whole. Um, yeah.
I would just add charts, just put each of the cell types, what they secrete, what are they responding to, and I think sometimes if you can create those, then you're learning them as you're writing them down. It's just kind of like anatomy where you're drawing. But I think it uses a little bit a different part of the brain and memory. So I always encourage to write things out, whether it's charts or tables. But I also recommend that because then you have quick reference. You can go right back to it very quickly.
And I'd say for the GI tract as well, because everything is progressively changing, thinking about it kind of in total, like what are the layers that I'm going to see? Like what are some common features that I'll see throughout the entire digestive tract? And then thinking about, okay, well, this area functions differently, so it's gonna look like this instead, or this area, is looks like this because it has this function, whatever structure function relationship makes sense to you, I think is really helpful just by establishing kind of a this is what everything does, and then this is special because of that, I think is helpful as well.
Okay. If there's no more questions. Deepthi, thank you very much for sharing your wisdom with us this evening on the histology of accessory organs of the digestion and GI tract. Okay. So that leads us to our third and final presenter for the evening. Uh, he will be talking about embryology of the gastrointestinal system. Uh, and we have from Sidney Kimmel Medical College at Thomas Jefferson University, Ravi Eaton. Ravi is from New York City. He graduated from Haverford College in 2024 with a major in neuroscience. He also ran track and field, focusing on triple jump and long jump. He is currently a second-year medical student with interests in pediatrics and physical medicine and rehabilitation. In his free time, he enjoys cooking, playing basketball, and playing board games with his friends. And so with that, Ravi, the embryology of the GI system is all yours.
Thank you. First, I want to say shout out to y'all for being here today on this Sunday evening. Thank you for having me. So today I'm going to be talking about the embryology of the GI system. We've heard a lot already about kind of different functions, different areas, the histology. Now we'll kind of go into how it's developing, look into some learning objectives. So let's get started. Okay, so the first learning objective, and this is our only learning objective, is to list the organs derived from the foregut, midgut, and hindgut portions of the gut tube. So we'll go through some questions and then kind of talk about explanations after each question. Feel free to interrupt me if you have any questions throughout the presentation or put something in the chat. I'll try to look at that as we go. Okay. A student with right lower quadrant pain is diagnosed with appendicitis. The appendix is a derivative of which embryological region or cells? You should get some Jeopardy music for this part. Okay. So everyone answered? So the correct answer is going to be midgut. So let's just look at the next slide. Okay, so here, as we've covered earlier today, looking at the different regions of the GI tract and how they break down into foregut, midgut, and hindgut. So the beginning of the GI tract, we have the esophagus, the mouth, the stomach. That's gonna go into the foregut, and then we'll talk specifically later about kind of what breaks each area because I have some questions on that later. Don't want to reveal anything too soon. But particularly for this question, we're looking at the midgut. So um, the kind of point at which the midgut and the hindgut split is going to be the transverse colon, the 2/3 right around here on mouses. And so our appendix is going to be down here a little bit earlier in that track. It's going to be right near the cecum, which is the beginning of the ascending colon. So that's going to be considered part of the midgut, which is going to consist of the small intestine, so duodenum, jejunum, ileum, and then a portion of the colon up until the 2/3 of the transverse colon. Okay. Next question. What germ layer, sorry, / cells form the epithelial, sorry, What germ layer slash cells forms the epithelial cells lining the GI tract? Okay. So the correct answer for this one is going to be endoderm. Most people got that correct. Good job. Um, oh, sorry. So looking at the layers, the endoderm is going to be that inmost inner layer, which is going to be part of the gut tube. And that's going to, we'll have another slide, look at this in a different way. If you look at kind of the gut tube right here, you have like the splenic layer, which is going to be contributing to a lot of the smooth muscle connective tissue. Some of the blood supply is going to go through there. And then you have the gut tube, which is going to be the glands and epithelium. So that's going to be like the epithelial lining would be the endoderm. And this is just looking at kind of the development of the embryo in different views. So you can see kind of, this is like a cross-sectional view. If you kind of cut it through the middle right around here, something like that, or you can see that this is kind of the innermost portion as the embryo kind of goes in on itself like that. It'll form that too, which is also going to include other portions, which will later become like the urological system, stuff like that as well. Okay. Next question. As the embryo grows, what landmark helps define where the foregut ends and the midgut begins? This is the one I kind of didn't want to allude to earlier, but well, okay. So for this one, the correct answer is going to be the area of the duodenum near where the bile duct enters. And before I go to the next slide, does anyone know what that is called or like a name for it potentially? This might be a hard question, but we'll see. Let's see if I can pull up the chat. Oh, oh, good, good. Okay. So yeah, major duodenal pillar is correct. So that's going to be the kind of the marking point between what the foregut and the midgut is. So that's the area at which bile is able to enter as well as pancreatic juice is able to enter into the duodenum for like mixing and whatnot. Um, and so another name is the papilla vater or vater. I'm not really sure how to say that correctly, but and then the other marking point is going to be between the midgut and the hindgut. As I mentioned earlier, just 2/3 of the transverse colon. Okay. Which region of the gut tube enlarges to form most of the stomach, and what key shape change occurs? So first thinking about where it is, what part of the gut tube it's part of. Is it foregut, midgut, hindgut? And then how is it going to be getting into its adult orientation? Okay. Sorry. So the correct answer is going to be foregut here. So just looking at the next slide, we can see. Sorry, did I start talking before it was shared, or was it previously shared?
You're
Can't
good.
really tell. That's good. Okay, sorry. Um, so looking on the right, we have kind of a breakdown of the different areas just to go over again, like the esophagus. We have the diaphragm, the stomach, duodenum, pancreas, bile duct, and the liver. And then on the left, we have some different images. So this is an image of the developing stomach. Here's the stomach in its adult form. I think this is an example of a shark stomach. And then this is like a ruminant, something like a cow or something, just like for funsies, not for testing or anything. So looking at kind of how it develops, you have a swelling, um, and that becomes the greater curvature, and then it'll rotate 90 degrees as well. So here we have like the lesser curvature of the stomach, then here's the greater curvature of the stomach. So this portion will swell, I believe it's the ventral portion, and then it will rotate 90 degrees. And then looking at some other development in that area, here's like the foregut, and then again, here's like kind of our area where we have the entryway of the pancreas and the bile duct. So that's going to be like our differentiator between the foregut and the midgut. So the pancreatic buds will form, there'll be a dorsal bud and a ventral bud, and those will eventually fuse. There are some conditions where like that doesn't happen and that can cause different pathology. Maybe it blocks off an area, maybe it doesn't secrete properly. You also have the bile duct and the liver developing, and then the gallbladder as well. So this is all looking at what's happening around like 30 days. And then there's some notes on kind of the order of it. I think they went through that in the previous YouTube video as well. Okay. So next question. During growth, which gut region temporarily herniates outside the abdominal cavity and later returns after rotating? So both the area that herniates and then also the amount of rotation. So if you know one, it can help. Oh, sorry. I definitely did that too early. Okay. Well, for those of you that already saw, good job. But most people were picking the right answer before I clicked it as well. So good job. So yeah, the correct answer is midgut. And then it's going to rotate 270 degrees counterclockwise. Kind of seems crazy, right? Um, so here's just an image looking at like the different points in development and how the midgut is going to change. So there's a herniation that occurs, and this is the superior mesenteric artery right here. That's just going to be the main blood supply. And then it's rotating around that blood supply, but then that is still being maintained. So that's going to later form the mesentery, which like kind of is the almost a cape for the small intestine, kind of gives it all the nutrients and stuff, gives it blood supply. So that rotation is occurring, and then you can see, it's continuing 270 degrees counterclockwise to eventually become what we see in the adult development. And then also, I think I included a little link here for a YouTube video if anyone wants to watch like after when the slides are posted, just kind of showing that process in a little like animation. Okay. Which major artery supplies all foregut-derived organs? So the correct answer here is celiac trunk. I think most of you got that. Good job. And then we'll talk about that later, but I want to first do a little challenge question. before we talk about the blood supply. So a newborn has bilious vomiting due to a developmental issue. Which embryological region failed to develop properly, and what artery normally serves this region? So just for context, bilious vomiting, in the word, it means that there's bile. So it has to be, if you think about how bile is mixing, um, there is bile in the vomit, so bile had to kind of enter that and mix with the food that was eaten. So just maybe a little hint at how far down it is. This is a tricky one. Okay. So for this one, the answer is going to be midgut, and it's the superior mesenteric artery. So it's a great time to kind of go over the blood supply. So it was a little bit of a vague kind of question stem, but most of you were kind of on track with thinking about it's probably in the upper half, probably somewhere near that foregut mega area, because we're having that bile, which again is like the ampulla or papilla, or the different names that we kind of papilla, botter, um, different things that we're talking about when we're talking about foregut versus midgut, that like differentiation. So looking at like the blood supply, we can see, where's my mouse? Oh, cannot see my mouse anymore. Oh, here we go. All right, so we have the celiac artery supplying the foregut, the superior mesenteric artery supplying the midgut, and then the inferior mesenteric artery supplying the hindgut. So that's going to be kind of our like biggest kind of like you should know breakdown of like the main artery that's going to supply that certain area. And then, within that artery, we've talked about branches off the celiac artery already. A lot of the superior mesenteric is kind of just like named for where it goes, like based on the area. And then similarly for the inferior mesenteric artery. And then again, it's just another view looking at kind of the development and how that different areas are being supplied. Just looking at, this is prior to that herniation, prior to that rotating clockwise as well. And then this is our case example, like our challenge question. So the case was an example of duodenal atresia, which just means that there's a failure of the portion of the duodenum to develop, or like, that tube is kind of cut off. So you get the double bubble sign, which is kind of an interesting name. And that's for you have a big like fluid air pocket in the duodenum as well as the stomach. So on imaging, you'll see kind of this sign, and there's no passage of any contents beyond that point. So it's kind of getting backed up, and that will, cause vomiting. So again, just looking at kind of the development, there are a lot of kind of pieces moving around here, so maybe something can go wrong, and that kind of causes this to occur. So it can be, a common thing, relatively common, not like super common, but. And I think that's all we have for today. If anyone has questions, you can put in the chat or unmute. Um, yeah, thanks for having me. You get this chat. Oh, yeah. See some questions that I think already got answered, but if there's any more. Yeah, yeah. So the question about if the foregut is basically the esophagus up to the proximal area of the duodenum before the ampulla Yeah, that would be correct, like including also the beginning portion as well. Um, so just everything from entering until you get until that ampulla vater or duodenal papilla, whatever you want to call it. And then a question about neuroscience. Um, yeah, I think it's a great major to choose. I think it's really interesting, especially now. There's a lot of like stuff coming out, new things that we're learning. I think in the past like 5 years and the next 5 years, like the amount that we will learn in neuroscience is only going to increase. And so it's like a really good time to, if you're interested in it, to learn about it. That being said, I don't think there's any like one major you need to do in order to like get into med school. Sorry for the background noise. The radiator is going crazy. But yeah, like pretty much, oh geez. Okay. Pretty much like any major, as long as you're interested in it, like you can go into medicine with that major. People do religion, people do all different things. Um, and then it's just as long as you take those kind of like pre-med courses. And even people kind of do that after college as well. So there's never kind of there's many paths you can take. But I think, neuroscience is a good major. I really enjoyed it. Yeah, sorry. I hope that I answered the question.
Any other questions for our presenters today?
You
I feel
guys are
like I've
already into the game.
lost, yeah, I feel like I've lost touch on how long the Zoom pause should be.
I just sometimes they're thinking about a question and you
Right.
don't want to, but give them ample time. So
Yeah.
we have plenty of time. But if there isn't, then we can end the session. I would just remind everyone that our next session will be Sunday, December 14th. Um, so make sure you put that on your calendar. Dr. Mapes, I'll give you the last word.
Sure. The question, what's the last topic? And I just closed my tabs. Deepthi, you're presenting next week, aren't you? Or are you later?
No, I'm January 4th.
Ah, okay.
Yep.
I was
Give me a
hoping you could
second
help me out.
here. The
Oh, I
next
got it now.
next one is urinary and reproductive.
Yep. And then
Urinary, reproductive, placenta and fetal membranes, things like that.
yep. Reproductive system is my favorite system, so it's always a good time.
And AnaBelle will be back, right? Or are you switching with Savannah now?
Yeah, no, it was a one-time thing. I'm gonna be back.
All right, all right. Well, looking forward to it. Okay. So then we only have one more left on January 4th. So we are almost done. Almost.
Getting close to that local exam.
I will stop recording.